everyone, and thanks again for joining us for another Dangerous Drug webinar, an ongoing educational mass tort series offered from druglawsuitsource.com. This series highlights some of today's most controversial pharmaceutical drugs and places a spotlight on many of the unknown side effects and complications of these drugs. Today's webinar is going to focus on Abilify, an atypical antipsychotic which is used to treat schizophrenia, bipolar disorder, and major depressive disorders. In this webinar, we're going to discuss some serious complications linked to Abilify and what to do if you or someone you love has suffered from these side effects. But first, let's start out by explaining the medical uses of Abilify. Approved by the FDA in 2002, Abilify is manufactured by Bristol Myers Squibb and the Otsuka Pharmaceutical Company, and it's consistently topped $5 billion in yearly sales. Abilify works by changing the activity of dopamine, one of the neurotransmitters in your brain, and along with treating psychotic conditions, it can also be used to treat major depression in adults and agitation in children with autism. The drug comes in many forms, including a tablet, liquid, or injection, including an extended release injection. It's also advised that before taking Abilify, you should tell your doctor your complete medical history. More importantly, like any drug on the market today, there are some serious side effects that have been linked to Abilify, and it's important to know about these complications before taking this drug. Studies show that older adults with dementia who take antipsychotic medications such as Abilify may be at an increased risk for death. Weight gain is also a common side effect of Abilify, and children and teenagers and young adults who take Abilify for depression are reportedly more likely to become suicidal. Additionally, Abilify has been linked to compulsive behavior side effects such as pathological gambling, compulsive shopping, binge eating, and hypersexuality. These compulsive behavior side effects may lead to lawsuits against the drug maker, because a strong case can be made that the companies did not properly warn patients and doctors of these serious side effects. There are reports that show people taking Abilify developed a compulsive gambling habit. In all cases, the gambling addiction ended when the patient stopped taking Abilify. A 2004 study published in the American Medical Association's Journal of Internal Medicine identified a potential signal for impulse control problems with Abilify, which may result in abnormal behavior such as gambling addiction. Gambling addiction caused by Abilify can have a devastating impact on an individual's life, which can lead to substantial debt, lost savings, divorce, unemployment, reputation damage, and severe emotional damage. Addictive behaviors tend to come in clusters. So if you have an eating disorder, a problem with drugs or alcohol or gambling, you may be a candidate for shopping addiction. Compulsive shopping or spending can be a seasonal trend for depression. It can also lead to anxiety, loneliness during the holiday season. It can also occur when a person feels depressed, lonely, and angry. Compulsive shopping is another serious side effect found among many people who take Abilify, including females between the ages of 40 and 49, and those who have taken the drug for 5 to 10 years. This can lead to financial ruin and oftentimes bankruptcy. It's recommended that spending addicts seek professional counseling or a self-help group to deal with this problem. Many communities have credit counseling centers that will also help with shopaholism. Binge eating disorder is a serious eating disorder in which you frequently consume unusually large amounts of food and feel unable to stop eating. Almost everyone overeats on occasion, such as having seconds or thirds of a holiday meal. But for some people, excessive overeating that feels out of control and becomes a regular occurrence crosses the line to binge eating disorder. So how do you treat binge eating disorder? Binge eating disorder is the most common eating disorder in the United States. It affects 3.5% of women, 2% of men, 1 and up to 1.6% of adolescents. Effective evidence-based treatments are available for binge eating disorder, including specific forms of cognitive behavioral therapy, interpersonal therapy, and dialectal behavioral therapy. All treatment should be evaluated in the matrix of risks, benefits, and alternatives. And decisions regarding treatment should be made after consulting with a trained medical professional and eating disorder specialist. It's also important to note that binge eating may also end when the patient stops taking Abilify. More than 24 lawsuits alleging that Abilify caused gambling addiction, other compulsive behaviors may soon be consolidated into a multi-district litigation. A motion for transfer order was filed in June of 2016, in which plaintiffs and Abilify's manufacturer agreed that centralization before one federal judge would benefit all parties. The parties also agreed that the U.S. District Court, Northern District of Florida, would be the best venue for the proposed multi-district litigation, according to reports. The FDA announced in May of 2016 that new warnings would be added to the labels of Abilify and Abilify Maintainer, which would warn potential users about compulsive or uncontrollable urges to gamble, binge eat, shop, and have sex. The FDA released a statement about the warning saying that, quote, these uncontrollable urges were reported to have stopped when the medicine was discontinued or the dose was reduced. These impulse-controlled problems are rare, but they may result in harm to the patient and others if not recognized. In 2007, the government alleged that Abilify's drug manufacturer Bristol Myers Squibb illegally promoted the sale of Abilify for pediatric use and to treat dementia-related psychosis. So what's the problem with that? Well, neither use is approved by the U.S. Food and Drug Administration, and although physicians are permitted to prescribe drugs for off-label uses, drug companies are prohibited from marketing them for uses that have not been approved by the FDA. Dozens of cases of compulsive gambling in patients treated with Abilify have been reported in the medical literature. In each case, the patient's symptoms improved upon quitting the drug. So what now? There's a clear link between Abilify and compulsive behaviors, including pathological gambling, shopping sprees, and binge eating. Drug companies have a responsibility to notify the public when a drug may cause harmful side effects. The label for Abilify does not mention anything about compulsive behaviors, including gambling. Many patients only found out it was a risk until it happened to them, and they suffered as a result. Patients who took Abilify and began gambling compulsively may have the right to pursue compensation from these drug manufacturers. Our Dangerous Drug Lawyers can help if you or someone you know has suffered from the development of a destructive compulsive behavior due to Abilify use. Our top-rated lawyers are handling individual litigation nationwide and are currently accepting new Abilify compulsive behavior cases in all 50 states. To get started, you can submit a free case review found on druglawsuitsource.com. or call 866-280-3417 any time of the day to tell us about your case. As always, thank you for tuning into our Dangerous Drug series sponsored by druglawsuitsource.com. If you have any questions about the complications and side effects caused by Abilify, feel free to email us at info@druglawsuitsource.com.